Elbow pain, here's how a chiropractic might help. First of all, we want to make sure the brain is clearly communicating to that elbow. So adjusting the neck and the shoulder is going to help. Number two, this is a long kinetic chain. We want to make sure that the elbow is not being overused, so we want to make sure that the shoulder and the wrists are also functioning optimally. So adjusting the shoulder and the wrists are also something that we do with a patient with elbow pain. And then lastly, addressing the elbow itself. Relatively simple joint. We can gently adjust the elbow to make sure that the joint itself is moving properly. And then by kind of pinching off slightly an inch or so above the elbow, we can have the patient flex and then go ahead and extend. Ooh, and that starts opening up and reducing some of the adhesions around the elbow joint. That's going to help the elbow move better. We do the same thing below the elbow joint and then opening that up. Again, a little uncomfortable at first, but as we start breaking those adhesions down, that elbow is going to work a lot more freely. Lastly, rehab. So we'd have the patient sit on our vibration platform, hands behind them, elbow into extension, and then based on that patient's symptoms, we're able to put as much or as little pressure on that elbow joint with the vibration. That's going to, again, attract blood flow and increase it and speed up the healing time. Last thing, of course, we'd encourage with any inflammation or pain in that elbow is some ice. So depending on the size of that joint, somewhere between 5 and 10 minutes of ice. Even better would be a submersion into an ice bucket.